Thank you, Mr. President. So the blueprint lays out the roles and responsibilities to enhance our partnership between the private sector and the public sector, bringing together state and local governments with the federal government to ensure that we can accomplish and achieve our core principles and objectives. We can have the first slide. The core elements of the testing plan include both three elements: robust diagnostic testing plans developed in partnerships with state, and I just really want to thank the governors and the health officials, both at the state and local levels, who've been working with us day and night to work through these issues, and also all the laboratory directors in many of the states, as well as the American Society for Microbiology, who've been working with us to ensure that the plans were efficient and effective. Within the robust diagnostic testing plans, it was really unlocking the full capacity of the state, increasing the number of testing platforms. We now have multiple tests for different platforms, increasing the ability to collect samples, increasing testing and laboratory supplies, and ensuring that we work together to make sure that every client receives the tests that they need. This is added with timely monitoring systems. And what do I mean by that? It's systems where we bring together the ability to not only diagnose the symptomatic, but proactively and interactively work with individuals that we know are at higher risk. We've worked with states to look at where the outbreaks have occurred when they're not in the large metros, and we see that it occurs very often in places of closed settings among our Native Americans and among our long-term care facilities. So an active monitoring program that's active, integrated, and innovative. And then combining us with the third element, which is the rapid response program, relying on CDC to be working with state and local governments to ensure that every symptomatic case, and critically the asymptomatic cases, are quickly tracked and traced to ensure that we can not only control this epidemic, but predict outbreaks before they expand. And then finally, the plan includes an approach of using science and technology to develop even newer platforms, more efficient testing, really ensuring that the antibody tests that are utilized and recommended by both FDA and CDC have high quality in predicting both exposure to the virus and antibody development. And then finally, working on innovative tests that could be high throughput and point of care, an antigen-based test, or a point of care expanded nucleic acid test. Thank you.
Thank you, Mr. President, and thank you, Ambassador Birx. If I could have the next slide, please. I want to spend just a couple minutes about going over where we've been, but more importantly, where we're going. I think we all can understand how we can group this into three distinct phases. First is our launch phase, when we were really engaging the emerging epidemic and the types of things we need to do. For example, mobilize the private sector to develop, test, and have EUAs. And I think you know over the past 2 months, the FDA has issued 67 emergency use authorizations, which is far outpacing anything that has been done or could ever been imagined. Galvanizing the research community in the commercial labs. The reason why we're here with ACLA Labs having done about 3 million tests is because of that day when it was galvanized by the President and the Vice President. We also set models in the community, those first community-based testing sites that were federally supported and really under the direction of the U.S. Public Health Service, people who had been in Japan testing people on the Diamond Princess to assure that it would be done right and it would be done safely for everyone involved. Then we moved to really scaling. That phase was very, very important because we knew we needed to be at an immense scale to enter the third phase about supporting opening again. This again, for example, a lot of my life is about swabs. It was enhancing the production capability of a small company in Maine called Puritan that you'll hear a whole lot more about, that is sort of the swab provider for the country, but also because of the FDA actions and the actions of scientific community being able to broaden the types to spun polyester. So U.S. Cotton can now come in and start delivering within the next couple of weeks 3 million swabs per week of a different type. It also did things like expanding the community-based testing sites. Whereas we started small with the commercial partners, you see today, right now, we have 73 of this 2.0 sites going to 110. And very importantly, this demonstrated the model. And 68% of those sites are in communities of moderate or high social vulnerability, and 22% are in the highest social vulnerability communities, so that we can make sure the testing gets where it needs to be. You've just heard that that could be expanded to thousands of sites. And finally, stage 3, which is very exciting, coordinating with governors to support testing plans and rapid response programs. Over the past week, a multidisciplinary team from the White House, HHS, FDA, FEMA, has met virtually with multidisciplinary teams from every state, Puerto Rico and the District of Columbia, to understand what their testing aspirations are and to make sure that we can meet those demands. We're going to have another round of those calls this week, but as we talked about earlier today, we will be able to supply every state with the supplies and the tests that they need that will dramatically increase the number of tests we've done to this point. And just to give you an idea, the supplies that we will be providing to states, the minimum that we're supplying to states is approximately double in that month than the Republic of Korea has performed in the 4 months to now accumulated, to give you an idea of the amount of testing that we're going to be doing. So I'm very excited right now as we complete this ecosystem with the large reference labs, the LabCorp and Quest providing the very high throughput, large-scale testing, the galvanizing of the hospitals and academic labs that Dr. Birx has done by a machine-to-machine understanding and promoting that with the governors, and of course using point-of-care testing when and where that's very important to stop outbreaks or in remote areas like in the Indian Health Service or in Alaska. Thank you, Mr. President.
Thank you very much.